It's heartbreaking to imagine receiving a cancer diagnosis and being too afraid to tell your oncologist that you want to explore an integrative approach to healing. Fearing judgment or dismissal, for many, this fear adds to an already overwhelming situation. I'm Megan Babcock, and today we're going to hear a little bit more from Katie about how she has advocated and empowered people in their own healing journey. Thanks for coming back with me. I would love for you to just really quick, in a sentence, help people know what is integrative medicine, and then let's go into how it complements conventional cancer treatments.
Yes. I'm so happy to be back here with you, Megan. So integrative medicine is that really comprehensive, holistic approach that uses modalities from our conventional Western medicine alongside of more natural approaches and really focusing on just the whole person, that mind, body, emotional, spiritual approach.
Amazing. And it sounds like who wouldn't want that, right? But if you don't understand it, which is, when we have medical providers and they're specialized, especially in oncology, they don't get exposure to these other things. Can you imagine how much time it takes to really become an integrative medicine practitioner? Because not only do you typically have a MD, DO type training, but you also train in a lot of other modalities, which allows you to have this approach. And there are a few oncologists out there, that are embracing that. But I would say it is not the normal. If you've listened to any of my podcasts from last season, you've heard about my husband had cancer and had to have a bone marrow transplant. And we were one of the fortunate who our medical oncologist had been a naturopath prior. I was just like, thank you, Jesus, because I am going to be going all into the complementary medicine side of things with all of these holistic approaches. I had gone in expecting that I'm going to get a lot of pushback, that they're going to think I'm crazy. But when I got to know his oncologist and that she had been a naturopath, my first thought was, wow, you go from holistic and looking at food as medicine and all of this to poison. Interesting, but wow, so powerful. And for me, that was such a good example of how they can work together. And so she never made me feel bad. I felt like I could share with her, these are the things that I'm doing with him. And she would help me understand, this is when you can't take this mushroom. It interacts with this. And I was so appreciative. But when we talked, that wasn't your initial experience. If I remember, you were saying that at first you didn't want to necessarily bring that up. So tell me a little bit about just the hesitation that people might experience when they're wanting to do this, but they don't know how to approach it with their medical oncologist.
Yeah, so I would say there was absolutely some hesitation. So integrative medicine, it's evidence-based. But because the mainstream oncology doesn't always have that awareness or that knowledge about those modalities, and unfortunately, I feel like we're still in the infancy of bringing stuff like that to the mainstream. And so there's a fear of sharing with a medical oncologist or anybody that's working in that mainstream cancer specialty, that if you bring up these alternative ways of healing from this dreaded disease, that they can instill some fear. I think there's fear that gets instilled, and that was my concern when my family was facing these big scary challenges, was that if we were very transparent about all of the things that we were trying, that there would be, at best, maybe some discouragement that it wasn't going to do any good, that it was going to be useless. Um, Unfortunately, I think integrative and more natural approaches very often get labeled as the people that are working in that get labeled as greedy, that they're just in it for the money. And that I think is a lopsided argument, because I don't think it's something that's well understood, because my experience has not been that. The more that I have grown in my knowledge of integrative medicine. But that was the best case scenario is that they're going to tell you that it's not going to do any good and that it's a waste of money. And at worst, I think they actually try to discourage you from even trying. And that it can even still be referred to as unfounded quackery at times. So yeah, there was definitely hesitation and concern about us being fully transparent with oncologists about these other things that we were trying.
So you bring up two things in that. One is how fear is such a powerful motivator, and how sometimes people will use fear in order to get you to do their recommended path. Something you talked about in our last episode was the knowing that you had inside of you that there's got to be something more, and then you started following that and finding a path that actually has brought you to healing. When fear is being used, it shuts down your internal knowing, that intuition that you have.
Mm-hmm.
And I just want to encourage people that you know your body, you live in it all the time. And so trust yourself too. Don't allow fear to be the thing that causes you to shut down, because when you get shut down, that also impacts your body's ability to heal, because our mind is so powerful in the healing process. And the things that we speak over ourselves, if we believe something's not going to work, it's not going to work. That's
Mm-hmm.
if we believe it is going to work, then it has a higher chance of working. And we see that in drug trials all the time, where the placebo has an effect. In fact, within the mental health space, there is a very high rate of placebo having an impact. I really believe our mind is so powerful. So when you shut down, when you believe something's not going to work, whether it is a Eastern or Western or a combination, it won't if you believe that it won't. And there have been stories of where one that I read where, now these are outliers, but it highlights the point, only have so much time to live, to go and say goodbye to their family and do all of these things, to actually go and do those things, to pass away, and then upon autopsy discovering that they didn't have cancer.
Mm-hmm.
Okay. Our mind is so powerful, and our intuition is the voice of our inner knowing. And so I just want to encourage you, if you are questioning, am I getting the care I need? Could there be another way? Your body's trying to tell you something. Your mind is trying to say, let's explore. So I just want to encourage you to really tap into that. The other thing that you were saying is that when someone doesn't know about something, it's easier to kind of shut it down because you feel fear on the provider side of like, I actually don't know how this all works together. And so it's easier for me, because I don't have the time to understand it, is to shut the conversation down. And that's a very quick way to do it. So it's really important that you bring together providers that are willing to talk to each other. So your medical oncologist doesn't have to understand the integrative approach, but are they willing to have a conversation and help to collaborate and look at things from a different perspective? If your provider can't do that, how does that make you feel? And is that a good fit? Because sometimes we think, I've just got to go in, I've got to do what this person says to me, no matter what. And if you're not feeling good about being able to have these conversations with your provider, then maybe you're not with the right provider. The other important thing is the people that you were talking about, Katie, these are people who are very well trained. So there are a lot of people out there who want to help people walk a natural path, but they may not have the experience. Maybe it's just, well, I helped my husband do it. Let me go tell everybody else how to do it. Now, I'm not really qualified to be an integrative practitioner. I can help you ask questions and allow you to think through things. But so really thinking about the quality of the professional, because unfortunately, there are people out there that kind of give it a bad name. And I think that's in a lot of ways what the medical oncologists are responding to, because there are very few integrative practitioners that are at the level to be doing cancer type protocols with patients. Would you agree with that?
I would absolutely agree with that. And it's like you said, they're kind of there can be those bad actors or just inexperienced actors who again are it's kind of like the maybe the oncologist who doesn't know about these other modalities. There can also be that person who does the natural approach thing, who isn't seeing the bigger picture, who doesn't know what they don't know. So
Right.
sure, absolutely. That's very true. And so there's so much value in knowing who you are bringing onto your care team. And gratefully, when my family found ourselves in the situation of really dealing with these cancer diagnoses, is that I already knew the providers within this practice. Like I had been their patient for
Mhm.
years prior. So I already knew that. So it's very important for people to, again, do their research, to do your research about what it is that your body needs to heal, but also who you're going to bring onto your care team to participate in facilitating that healing.
I love that you highlight one, your own experience, but two, you're a nurse. You've worked all these years in the traditional healthcare. You understand the language, but now you understand this whole new language of integrative medicine and how powerful it is to have somebody like that, right? When you're the patient, it was even hard for me to do it with my husband because I'm sitting in there, you're getting all of this information, and because it's someone you love, it's I can do it, but it's harder to like hear exactly the things they're saying and figure out the questions to ask because it's hard as the patient. You're getting all of this information coming to you. If you don't have a medical background, it's like, I have no idea what they're saying to me, so I just have to do what they're saying because I don't even know the questions to ask.
Hmm.
So, if you're listening and you're struggling in that place, maybe you have a chronic disease, you've been struggling with your mental health for a lot longer than you think you should because you've tried all of these different modalities, or you have a cancer diagnosis. There are a whole group of nurses in this world who have left bedside and are taking this holistic approach to healthcare that can help as your advocate to really understand kind of what is it that's being said by these professionals? What are all of the different things that you might explore? And so I would just encourage you, if that is you, leave a comment on this podcast episode because Katie or I or one of the nurses that we collaborate with could work with you based off of, where you live. So I just wanted to throw that out there. Now, Katie, I want you to walk us through how you eventually did talk to the medical oncologist and the team about the different things that you were doing. And what was
Yes.
their, what was the experience? Was it as bad as you feared, or were they a little more open-minded?
Yeah. So, you mentioned how we can help people advocate and learn what questions to ask, or really to navigate being the person that can help them answer those questions, or ask the right questions. And I felt like that was very much my role in dealing with the oncologist. So, um, I was so sure and believed so much in the power of pulling in these other ways to support the body in healing, that that's why I was present for appointments. Because if there were any questions that came up, I didn't want there to be the fear that was instilled into my family, to make them question whether or not what they were doing was the right choice for them, because we had decided together that it wasn't the right choice. So I didn't want
Mhm.
anybody causing fear to be instilled. So I was very prepared to be that person, because I do feel very knowledgeable about this. I don't have any lack of confidence in my ability to talk about it and to be that advocate. So that was really what I went in, not feeling defensive about it, but ready to be assertive if needed. And pleasantly surprising, we didn't run into any pushback. There weren't a lot of questions that were asked, but I have heard oncologists um, have that more narrow focus opinion about it, because they don't know the other things. And so I was pleasantly surprised that we at least didn't receive any pushback. There wasn't any pushback, and everything moved very smoothly from there.
I love hearing that. And I think that it probably was so helpful to have you in that room to be able to kind of navigate those discussions and help to bridge the gap between the provider and, these other approaches. Tell us how your parents are doing. Yeah.
Yeah. They are both doing well. So again, my dad was the first one to have this diagnosis, and gratefully, mainstream treatment was definitive for him with surgery. My mom's path has been a little bit longer, but she is doing very well at this point. The combination of the conventional therapy that was recommended by oncology, alongside of what integrative medicine suggested for her, has been exactly what we needed it to be.
I'm so happy to hear that, and I wish them all the best, as we know that these journeys can be long, and the changes that we have to make in our life, the integrative approach isn't something that just stops when you are cancer free, because these supports are really so that your body can function optimally. I believe our bodies were created to heal. Just what is the environment that we're creating for them? And so the journey never ends, kind of like you were talking about your healing journey on our last episode. It's a new way of doing life. So as we're wrapping up, I would love to hear how your eyes were opened through your own personal journey, your journey with your parents, but what is it that you do now? And who are the clients that you also work with, not from just the physical side of like advocating for this holistic approach, but we know that so much of our health, right, is dependent on our mental health and our ability to navigate stress and trauma from the past, and that can show up in the body. So what else do you do in this space?
Yeah. So my experience all those years ago, and finally getting to a place where I was not in pain every day, had me understanding, knowing, and believing that I was not reaching my full potential at the bedside. The comfort of my job that I enjoyed in the hospital kept me not reaching my fullest potential for a long time. But 3 years ago, I took the first step to becoming a certified nurse coach. And I have been working full time as a transformational life coach since the spring of 2022. And just bringing in that whole person approach to what I do, we focus on so much of the mindset portion when I work with clients, because if we can't get our mindset healthy, then it is hard to get any other part of us healthy. You mentioned fear earlier and how it can really drive our symptoms, drive illness, and just drive disease. And that's something that I really find as a foundation of what I do is how can we get away from the fear of things and believe what you were saying, that our bodies were created to heal. So I just love working with people on, they may come to me wanting to change the way they eat, but we're going to work on what it is that's lying deeper about why they've always struggled with their relationship with food.
I love that. Well, as we're closing, you guys, the World Health Organization has named stress as the #1 epidemic of the 21st century. And stress, you guys, is just another symptom, right? And so we're here to help you to uncover what it is that is creating the symptom of stress. And then those symptoms of stress create things like heart disease and metabolic disorder and all of these different unhealthy, addictive habits in our life because we are trying to be comfortable. We don't want to live in a stressful environment. Our body doesn't like it. And so we turn to things that can actually cause us more harm and create more problems for us. So we're here to support you as you are uncovering these things in your own walk, in your own journey. Over the next course of these episodes, you're going to hear from a lot of coaches that are really focused on helping you to uncover root causes. If you enjoyed this episode, please like and share it on your favorite social media platform because your help will amplify these incredible stories, and we never know whose lives that it could improve. Don't forget to follow It's Your Story to Tell on YouTube or your favorite podcast app to catch future episodes. Katie, thank you so much for being here. And listeners, thank you so much for being part of our community.